Next, we are going to discuss about the BPAP. First episode, we are going to discuss about, you should know the building blocks of our NIV BPAP machine. Okay. So, whenever initiating the BPAP, so BPAP itself a bi-level positive pressure. There is one pressure is IPAP, okay, other one is a EPAP. Okay. First is that EPAP will be the end expiratory positive airway pressure, which means that this pressure will be delivered during the both inspiration and expiration. It's called expiratory PAP. Okay. Other one is the IPAP. This during the, we set a EPAP, that will be delivered during the inspiration and expiration. IPAP means that is the pressure, additional pressure delivered during the inspiration. See here, this EPAP will be there during the both inspiration and expiration. During inspiration, this additional pressure is delivered. It's called IPAP. Okay. So I already told EPAP has a two benefits. One is the opening up of your upper airway, sprinting of my upper airway. Second is increase my end expiratory lung volume. The IPAP mainly for the ventilation. Okay. So the difference between EPAP and IPAP, okay, which is called pressure support. For example, patient my ICU ventilator with a PEEP of 10, my pressure support of 10. Okay. Which means I changing the patients from the ICU ventilator to our small devices BPAP machine. I have to set a EPAP of 10. My IPAP will be now 20. Why it's 20? I already told the pressure support is minus EPAP minus IPAP minus EPAP. For example, my pressure support is IPAP is 20. My EPAP is 10. What will be my pressure support? Is 10. So my patient is already on ICU ventilator. 10 pressure support means when I changing the pressure support to BiPAP machine, I have to set a IPAP of 20. Okay. So this pressure support will determine my tidal volume. So the pressure support, the tidal volume depends upon few things. Most important thing is my pressure support. If I want to increase my tidal volume, I have to increase my IPAP. Okay, it's very important. Okay. Other things that you should know about the basic waveforms of our BiPAP. First thing is that one thing first you should call trigger. Trigger means that how the ventilator initiate the breath. So how ventilator usually initiate the breath? It used to be all our BiPAP machine used to sense the patient inspiratory effort. So that is called then sense and give the breath. That is called trigger. Okay. So, if example, there is a flow change. If example, my patient taking inspiratory effort, what will happen? Some of the air will goes to the patient lung. There will be some change in the pressure or flow change in the circuit. These changes will be detected by my devices. The ventilator will give breath. For example, I set a trigger sensitivity of 2 liter. Okay. If my patient taking a spontaneous breath, flow in the circuit 2 liter, the 2 liter will goes to the my patient taking a spontaneous breath, negative pressure. Okay. Because of the negative pressure, some of the flow will go to the patient's lung. Okay. So because of the some of the flow goes in the patient lung, there will be a flow defect in the circuit. Okay. If the flow defect is 2 liter or more than 2 liter, the ventilator will sense that and gives a breath. Okay. For example, I set a 3 liter as a trigger sensitivity. My patient's only taking a inspiratory effort, but the flow defects occurs only 2 liter. The ventilator won't give the breath. Okay. If the patient taking an respiratory effort, it decrease the flow in the circuit, the 3 liter, ventilator will give the breath. It's called trigger sensitivity. Okay. Second is called rise time. What is rise time means? If example, my EPAP is 10, IPAP is I kept as a 20. So during inspiration, what will happen? The pressure will increase from EPAP to IPAP. How much time? How rapidly the ventilatory pressures are reaching from EPAP to IPAP, which is called rise time. For example, flow is, it's called, it says rise time is very slow. If I give the breath, it's called rapid rise time. Okay. It's called that rise time. How rapidly the ventilator pressurize the patient's lung. How rapidly the ventilatory pressures achieving from EPAP to IPAP, which is called rise time. Third one is the inspiratory time. How much time the device spends on the IPAP. For example, my IPAP is 20, EPAP is 10. So EPAP during inspiration, the pressure will reach from the EPAP 10 to 20. How much time the ventilator pressure is keeping that 20 centimeter it's called inspiratory time. Okay. Next is that once the inspiration ends, the patient will go for the inspiration to expiration. Okay. It's called cycling. Cycling means that inspiration ends to inspiration to expiration. It's called cycle sensitivity. Few things are there. All our BPAP machines are flow trigger, not a pressure trigger. ICU ventilators have the both pressure trigger and flow trigger. Our BPAP machines are flow trigger because the flow sensitivity is better than the pressure. So that's why all our BPAP machines are flow triggers. Cycle also, most of the ICU BPAP machines are flow cycling. Okay, we'll discuss in the later. So the basic things you have to understand: trigger, rise time, inspiratory time. Third is a cycle sensitivity. Okay. So in the area of this waveform is deciding the tidal volume. Okay. So